Hello, I'm Kapil from Health Siren, and today we are going to discuss about Shivambu. We have a great authority on Shivambu, Surya Namaskar, naturopath, and traditional acupuncturist with us. He is Mr. Anand Bapat. So today he is going to introduce us Shivambu, its benefits, how to practice Shivambu in our day-to-day life, and also the dose for or cure to get off the medicine. Okay, so let's begin with Mr. Anand Bapat. Mr. Anand, when did you hear about Shivambu?
Yes. I first heard about Shivambu when I was a college student because we had a Prime Minister, Sri Morarji Desai, who publicly used to make statements when interviewed that I take Shivambu. So that was the first time, and of course, all of us laughed and said he drinks his peace.
Okay, his Prime Minister making a statement.
Correct.
Okay.
But that time we didn't see the value of it. Then, as I later went overseas and got involved, I got involved with my own work in acupuncture and occupational therapy. And I forgot everything about Shivambu. I didn't give any credence to that and forgot all about it.
Oh.
Well, I didn't have the knowledge. I just heard that Morarji Desai used to do it.
Okay.
So I never studied it.
Yes.
I studied acupuncture because that was another pati.
Hmm.
And then I was practicing my occupational therapy. So that was my life the way it was going on.
Okay. What made you start practicing Shivambu?
Two things happened. I was living in Australia for many years, and I used to come and visit once every 3-4 years to my family here.
Okay.
On one of my visits, one of my relatives, as I was leaving, gave me a book. I didn't even bother to check what the book was. They said, "No, you should read it, it's good for you."
Okay.
So when I went to Australia and I started looking at the book, I said, "Arey, this book was given by my relative.
Hmm.
Wonder why he gave it to me, because it was about urine therapy."
Okay.
So I read it. And after I read it, I thought, okay, maybe it works. And then at that time, I used to enjoy my alcohol. So I used to drink all types of alcohol, beer, whiskey, rum, everything.
Okay.
And I thought, if I can drink all that, maybe I should have no problem drinking urine. There should be no problems.
Right.
That was just my thought. So for 2-3 days, I just drank urine in the morning. I said, hey, no problem. If I want to do it, I can do it. It's not a big deal. But the book says it. So I said, okay, I put the book aside and forgot about it.
Okay.
Then a few years later, we migrated back to India in 92. And when I came back here, this is what I call God, luck or fate or whatever you want to call it. Within a period of 6 months, I ran into 1, 2, 3, 4, 5 different people. We talk about something, we talked about different things, and they say, "Oh, Shivambu, it's so good, it's wonderful, it's this, it's that, I'm practicing it, it's wonderful for health, good for the skin, etc., etc." And then I had somebody who was suffering from some illness, skin problem. And I thought maybe we should consider using that.
Right.
But coming from the allopathic occupation therapy background, Western medical thinking, urine is a waste,
Right.
it may not be good for you.
Right.
I said I should not go and give somebody a patient prescription and they might die. So let me test it. So for about 1 month I drank every day.
Okay.
And at the end of the month I felt no different, I felt better, there was no problems. I said now I can try it. And then when I tried it on the patient, it was like immediate success.
Okay.
Within the week the patient recovered, started feeling better. Then I took it upon myself that yes, this is something very potentially powerful.
Okay.
We need to look at it. That particular patient had been suffering for many years.
Okay.
So they had no cure, they were just suffering.
Okay.
So when that change came about,
Okay.
it definitely triggered me to think, hey, there is something in it. So then I started studying it in detail.
Okay.
At that time, I was in Pune, so I met people like Arvind Joshi. I read all the books available, and then it took off from there.
Okay, means after studying you come into your own practice and means first you practice yourself and then you started studying.
Correct.
Okay, so at that same time you started prescribing to the patients.
After that, I started prescribing to patients as required. At that
Okay.
time, my practice was mainly acupuncture.
Okay.
So I used to select certain patients who, if they are willing, I would not push it on them. Because even though I knew it was good, I felt maybe they may not like it.
Right.
So I used to offer it.
Hmm.
And as chronic suffering, severe, non-responsive to other pathies, patients used to come to me.
Hmm.
Some of them were prescribed Shivambu, and the results kept getting better every time.
Right.
Any type of case, you prescribe Shivambu and it seems to work and work well.
Nice.
Plus, it's free
Yes.
and patients are getting results.
Right.
So I had no problem. So slowly it took off from there, and then as confidence grew, as results got better, I started prescribing a bit more and more.
Okay, so you mentioned about the different doses for different patients. So, how do you think that Shivambu works in the body?
That's a very interesting question. I've been practicing now for 25 years, and for the last 15 to 20 years, I have been perplexed with the thought of Shivambu is giving us results. We watch a patient on the clinical side, their symptoms disappear, their suffering eases, their quality of life improves, their disease process changes. But when we try to figure out how does Shivambu work, we always seem to come at a stumbling block.
Right.
Now, coming from my allopathic background of thinking, because of my occupational therapy education and understanding allopathy, it is very clear from allopathic perspective that if you are suffering from cold, there is one treatment. If you have got fever, there is another treatment.
Right.
If you have got typhoid, there is a third treatment. If you have got cancer, there is a different treatment. If you have got kidney problems, there is a different treatment. If you have blood pressure, there is a different treatment. And they are all effective.
Yes.
When you come to Shivambu, any or every condition you give Shivambu and it works.
Right.
Now it is very difficult to explain to anybody in the way we think, unless there is a different way of explaining, that how is this possible? And it is one of the, let us say, enigmas or dilemma for everybody in terms of understanding this pathi. Yeah, how can you just take Shivambu and any disease can be fixed?
Yes.
So while this has been going on, I have been trying to analyze to see how may this be working? What could be the reason? Now, a long time ago, I had read a book about vibrational therapy or vibrational medicine.
Yes.
It was written by a well-known author. In vibrational medicine, he talks about any pathi, doesn't matter what it is, whether it is herbs, whether it is spices, whether it is fresh air, deep breathing, whether it is pranayam, whether it is yoga, whether it is allopathy, homeopathy, ayurveda, Unani, surgery, acupuncture.
Okay.
He mentions that if the vibrations given to the body are of the right frequency, then the body will respond favorably.
Oh.
And he proves that an aspirin tablet, a BP tablet, has got certain vibrational qualities.
Okay.
At that time, this was in the early 80s, at that time I was so positive that in the next 10-15 years, the whole world of medicine will change and medicine will become vibrational medicine and there will be no gaps or fights between allopathy, homeopathy, ayurveda, acupuncture, because they will all look at it and say, this is the frequency we need to generate, can you do it, can you do it, can you do it, let's do it better.
Okay.
Today, unfortunately, I have to say, as much as I hoped that that would be the medicinal status of medicine, today it never transpired. Vibrational medicine just stayed as it is. Anyway, so I felt that one of the theories that may explain this is Shivambu, when you take it in the body, may be creating a certain set of vibrations. Like, say, for example, ringing a bell. Now, ringing a bell is very gross, huge. But this might be just creating some vibration that it is informing all the cells of the body, this is normal.
Okay.
And so the body tries to go towards normal. So whatever is abnormal, whether it's disease, whether it is ill health, whether it is symptoms, whether it is fat, slowly start disappearing.
Right.
And you get recovery. Now that is one of the scenarios that may explain that Shivambu can work in every scenario.
Okay.
Okay. But how do we do research on that?
Right.
We have to prove it.
Prove it, yes.
So that became a stumbling block. Then I was talking to one of the senior people who used to be a Shivambu practitioner, who is still living,
Yes.
but who is a Shivambu practitioner.
Hmm.
And on discussion with that person who was an engineer, and obviously he's still an engineer, although retired, his thoughts were, he said, in the electromagnetic spectrum of loudspeaker technology,
Yes.
the fundamental thing we do as engineers is design a speaker such that it takes the voice, modulates it, cleans it, transmits it, feedback, and loops again.
Right.
And it does it so many times per second that it filters and filters and filters, and then you get the speaker to give you beautiful sound.
Right.
And he insisted that, in his belief, if you take Shivambu, because you're taking Shivambu every day, over time the Shivambu will purify the body as well.
Oh.
Which from clinical perspective, we agree.
Right.
But how do we test this?
Yes.
Is this really happening? Could this be happening?
Yes.
But that is a viewpoint that we have to share with our people.
Yes.
Today, after a lot of continuous research, continuous thinking of how it might be working, why it is working, how it is effective, I've just stumbled on something recently, and on that I'm going to have a separate video in this series, where I feel Shivambu may be acting on mitochondrial activity.
Right.
Now we all know that mitochondria are the powerhouses of the cell.
Yes.
There is enough evidence to say that mitochondrial numbers reduce from birth till death.
Exactly.
There is enough evidence that as the numbers reduce, people feel cold, people feel inhibited, people feel lethargic, people feel lack of energy, people feel older.
Yes.
There is enough evidence that when we are sick or ill, mitochondrial activity reduces.
Yes.
There is enough evidence that in different disease states, mitochondrial activity eases off. There is also some evidence to say on a generic level that a lot of the allopathic medications do negative effects on the mitochondrial activity. So they actually either stop it, reduce it, or kill it.
Okay.
And on the other side, there is plenty of evidence. If you improve your oxygenation, mitochondrial activity improves.
Yes.
If you exercise regularly, mitochondrial activity improves. If you sleep on time and sleep well, mitochondrial activity improves. If you go on a fast, mitochondrial activity improves.
Yes.
If you have a cold shower or a hot steam bath, mitochondrial activity improves. If you have a massage, mitochondrial activity improves.
Okay.
So when you compare all these things and then put them in a big block, basically you will find anything natural or natural therapies appears to increase mitochondrial activity. Anything synthetic, which is mainly about allopathic medicine, seems to do harm to mitochondrial activity.
Right.
Aging tends to do the same. And here we have got correlated evidence from Shivambu practitioners that they feel free from disease,
Yes.
their quality of life improves,
Yes.
Their energy level changes.
Yes.
They feel and look younger.
Right.
Most people who are regular practitioners at Shivambu are generally dated 5, 10, 15 years younger than what they are.
Oh, yeah, right. Exactly.
And this is from public experience. Other people feel that, "Arey, I didn't think you were that old, you are much younger."
Yes.
Okay? And all these are signs of good mitochondrial activity.
Yes.
So now my hypothesis, and I wonder very seriously, is Shivambu linked to mitochondrial activity? But this is a process for research, and as I said, I'm going to talk a bit more about this mitochondrial activity in another part of the video in this series.
Okay.
But that is where I am with the how does Shivambu work concept. We are still in the dark,
Yes.
but maybe we are having a light at the end of the tunnel.
Yes. Yes. So you talk about the clinical trials. You treated so many patients.
Yes.
So can you give us some cases, case history regarding how you treated the patients with Shivambu?
Yeah, sure. See, it is very difficult to have clinical trials because we don't get a bunch of them that we can treat 20 or 30 similar patients with Shivambu and get results and find how they respond.
Right.
Unfortunately, people coming for Shivambu or people coming to practices that are in complementary medicine, so whether it is natural therapies, whether it is acupuncture, whether it is acupressure, the tendency is patients have gone to allopathy, homeopath, Ayurveda, done faith healing, done so many things.
Yes.
And when they don't have any hope or lost all hope, they turn to us.
Right.
So unfortunately, we actually get them when they are really what we call one foot in the grave syndrome, where they are really at their wits' end and they don't know what to do, so they will try this anyway. So the patients coming to us are comparatively few and far between, but I do have a few very interesting case histories which I would love to share
Yes.
without giving names,
Yes.
where the cases were incredibly fruitful.
Yes.
The first one I'll talk about is a case history about a young man who had terrible skin problems. When I say terrible skin problems, he had patches like leather on his knees, on his ankles, on his elbows.
Okay.
And he was a fair guy. He had become allergic to the sun. Sun contact used to give him irritation. So he always wore caps and everything else. And he had tried everything, natural therapy, allopathy, the works. And he was not getting any results. His father had actually told him a year ago, why don't you go and meet Anand, he might do something for you. He does a lot of different things, why don't you try?
Right.
It took the young man nearly a year to come and see me.
Okay.
When he did come, we talked about Shivambu or urine therapy as it's to be prescribed and used. And he said, I said, look, I think it will work. To prove my point, I had aged urine about few years old,
Okay.
which I normally keep because for emergencies or for extreme external use, it is very potent.
Right.
So I took a small sample of about 30 ml and gave it to him and I said, look, what I want you to do, you've got problems all over the body.
Right.
Why don't you use a little bit on one arm where you've got identical problems. So you use only one arm,
Right.
you apply it, leave it for a few hours, about an hour, then wash it with water without soap.
Okay.
And then see over the next 24 hours whether you get relief. He did that and he said, oh, that arm is not itching anymore.
Right.
He got immediate results.
Yes.
Now, of course, to get age urine means you have to go through a long process. And literature talks about and experience talks about using age urine for external use.
Exactly.
So the next best thing I told him was you collect urine, collect few liters, boil it, reduce it to about a quarter, and then you can use that. So he decided to do that. Since he decided to do that, applied every day, have a shower without soap, etc. Within 3 months, he started improving.
Right.
By the end of the year, he was pure fair skin, not a single patch was left on the body.
Yes.
Not just the patch, the patches disappeared. In addition, there was no scarring either. It was as if they had been removed without a blemish.
Wow.
Beautiful natural skin. I was shocked. I was expecting some black marks or rough marks or something. Completely free of everything.
That's great.
And he didn't need to wear a cap anymore. He could be free.
Yes.
And that to me was just wow. It's like it can do so much.
Yeah.
Of course, that particular person had to drink his urine and apply it every day.
Okay.
Okay? So, like that, there are different prescriptions for different things.